Let's begin. For those of you that were also expecting Carol Pandick, I'm very sorry to say she's not going to be part of this presentation. If you don't know Carol, you want to get to know her. She has been the Rotary International Director for Polio Plus since I believe it was 2000. It's been over 20 years. You can look at her YouTubes or go to even CDC or Rotary.org and catch on a couple of her interviews. Very knowledgeable, very good source, but had some conflicts, so that didn't work out. But as Lindsay said, if you have questions, you know, that's a part I don't like about Zoom. Well, there's a lot of things I don't like about Zoom, but that's a different presentation. But just let us know and we'll proceed. So the job today is to talk about COVID, talk about polio, similarities, differences, and then touch on what we have planned to do in Rotary Year 2021-2022 for polio, something the district has never done before. So we'll keep you in suspense until we get to that slide. But starting off with the similarities, obviously COVID's on everybody's mind right now, and we're trying to make sure polio is also. When it's all started, both viruses were essentially invisible, unknown to the public. It came out of nowhere. The reaction by the general public, the viruses created a lot of fear, a lot of suspicion, a lot of finger pointing. COVID always gets compared to the 1918 Spanish flu pandemic because it was a pandemic, but so many similarities. With both diseases, there's a significant number of cases that are asymptomatic. The people don't know they have the disease, whether it's polio or COVID-19. And the infected people, though they don't have the symptoms, are still capable of spreading the disease. And that's always been a major issue with trying to control it. And the last item I want to cover as far as similarities is both viruses, as many do, they have the ability to mutate, and they have the ability to select, as we call it, structural stability. They find a way to avoid the remedy, and by mutating, we have to make sure that we can take care of that. Looking at it in the sense of differences, the polio virus, it's exclusive in that it's a human disease. It's affected humans for thousands and thousands of years, all the way back to the ancient Egyptians, whereas the SARS-CoV-2 virus, it had not been previously identified. So it was something new when it hit the mankind. Polio is only transmitted between humans, whereas the coronavirus can be spread sideways between humans and animals and back and forth. Polio does affect the muscle and midbrain nerves that control vital functions, including respiratory. And COVID is both basically attacking the primary respiratory organs. Once again, COVID-19 is spread through respiratory droplets, hence the cry for masks. And the polio virus is more intense, intestinal. There are reports that it could possibly be passed by respiratory, but it's basically an intestinal, or we call it a gut virus versus the respiratory virus. And the last difference I wanted to mention is polio affected primarily children and adolescents, where COVID-19 was definitely more serious and fatal, as many of us have experienced with older adults and those with underlying medical conditions. So just some of the differences, but as we look from what we've learned from polio, the number one thing that has come to light in the sense of trying to take care of COVID-19 as well as polio is, as I call the Holy Trinity. You have to prevent infection, you have to prevent the transmission of it? And also, how do you prevent the disease? And that leads us to creating a long-lasting countermeasure like a vaccine, but a vaccine that will grant us long-term immunity, something that we still don't know yet with COVID, whether if you get your 2 shots or your 1 shot if you're Johnson & Johnson, is that going to take care of us more than 1 year, or is it going to be like a flu vaccine where it's repeated every year in order to keep the immunity system up and fighting it? With both cases, we've learned that there's a need for global cooperation. Funding for COVID-19 almost exclusively came from the government, whereas with polio, it's coming from donors, especially Rotary. The research has to be global and the immunization effort has to be global. And that's where Rotary comes in the ability to provide research, but mainly the immunization. And with that, there's a need to create a network to get the information out about COVID-19, to create awareness about the disease and its effect, and also to educate. We don't want to eradicate the people. We want to educate the people of the disease. And that's what we're trying to do now. You're obviously with COVID-19, it's controversial for some people, but for polio, it's a little bit different in that, yes, no one's pointing fingers right now. RI, back in December, established a task force to have volunteers and Rotary itself work to help eradicate or educate again, I'm sorry, COVID-19. Club volunteers have created awareness by going to low-income neighborhoods, getting the word out, doing flyers, a lot of boots on the ground, shall we say, as far as trying to get people to understand that things have to be done. You have to get a vaccine. You've heard so many times, wash your hands for 20 seconds, cover your face, social distance. But one thing with COVID-19 and Rotary, it has been the vaccine cold chain. And the cold chain is some of the vaccines for COVID as well as for polio have to be refrigerated. They can be frozen, but they have to be refrigerated and they have a shelf life. And that's one of the issues. And that's where a lot of the governments came to Rotary and asked for assistance, because we've been doing it for years. And this worldwide vaccination effort is crucial to defeating the current COVID-19 pandemic. The logistics of getting it done are incredibly complex, and the most complicating factors are storage and transportation. The pharmaceuticals did a wonderful job in getting approval and getting the vaccine, where a lot of people said it's going to be years before we could get a COVID-19 vaccine. And within a year, it became a done deal. And now there's 3 coming to possibly a 4th vaccine. And that is, once again, it's remarkable, but now it's the storage. The first couple months, it was, we can't get enough vaccine. We got more people that want to get vaccinated, long lines. Now it's a little bit different. If you haven't gotten your first or second shot, they're going, I think California now is all the way down to age 16, where they had different tiers. But it's getting the vaccine. Granted, United States is a industrial nation, modern, a world leader, but it's the rest of the world that has to also be taken care of. And it's getting that disease, keeping it cold so that you don't have spoilage and you have all these doses that have to be thrown out. So it's a transportation. It's not, hey, let's throw it on, put it in a box, throw it on a truck and drive it there, put it on a plane, get it to whatever country it needs to get to. But it's more than that. It does have to be cold storage. or we call seamless cold chain storage. And that requires three elements. You have to have the equipment, which is expensive. Refrigerators and freezers will run roughly $15,000 to $20,000. And it's the same equipment that's being used for the polio vaccine. You have to have the personnel, the first responders, the nurses, doctors, volunteers. They've been fantastic. Rotary has an army already, and the volunteers have been going out there trying to inform the people, but also helping, not necessarily giving the vaccination for COVID-19, but helping the volunteers on the COVID-19 side, showing them and educating them, here's what has worked, here's what we've done, and we can help volunteer and help those efforts. And then lastly, it's the whole process, which once again, Rotary has 25, 30 years of experience and have perfected the process to the point where governments, the Bill Gates and Melinda Gates Foundation, have given money to help support this because they know Rotary knows what they're doing. And it's hats off to all the Rotarians and volunteers. The Rotary's fight against polio has been going on since 1979. A lot of people say, oh, 1985. And it's like, well, yes, but the first incident was basically a club in the Philippines back in 1979 wanting to vaccine children. And since that period of time, you'd love to say we're 100%, but we're 99.9%. And we're successful in, it's with the assistance of the Global Polio Eradication Initiative and all its partners, CDC, Rotary International, the Bill and Melinda Gates Foundation, who it's working together and then working with all the governments and all the volunteers. Since that time, Rotary has, Rotarians have donated more than $2.1 billion and unbelievable countless hours of volunteer hours that the people at clubs, people going on IMDs, it's just an amazing thing, but we've been able to protect 3 billion children in over 122 companies. That's what Rotary is all about. To me, there's a lot of reasons you join Rotary, but to be part of something that is trying to do something that hasn't been done other than once, to me, it's an amazing thing. And because of Rotary's efforts, governments have contributed more than $10 billion to that, not counting what the Bill and Melinda Gates have given and other organizations have given. So it truly is a worldwide effort, and we are getting there. We're almost there. I like to say we're that close. A little bit of a history. In the 1940s and 1950s is when polio was at its peak. And during that time, over 500,000 people were either paralyzed or killed. In 1944, polio was eliminated in the Americas, South America, North America, Latin America. In 2000, 36 Western Pacific countries, including China and Australia, followed 2 years later, Europe being declared polio free. And for those newer in the clubs, in 2014, India being declared polio free was just unbelievable because no one thought we would get there. And then last year, Africa became polio free. So we are eliminating one by one the countries, and right now we're down to two per se, Afghanistan and Pakistan. 1953 is when Jonas Salk created the inactive polio vaccine. And getting back to the Holy Trinity, the vaccine prevented the disease, but it didn't stop infection and it didn't stop the transmission. It was given by an injection, but once again, if you got it, it would stop the disease, but if it didn't stop infection from that person going to another person, or like I said, the transmission of it. Albert Sabin in 1961 then developed a live oral polio vaccine. It was cheaper, easier to administer, and it did prevent the disease, the transmission, and the infection. 2020, with COVID-19, scientists have engineered a virus that can be used that greatly reduces the likelihood of mutation and recombination events. In other words, it's curtailing the capacity of the virus to adapt any further. If we can stop that mutation, then we're ahead of the game, because then the polio vaccine we have is working. And once again, that's what we're trying to do. Questions I've gotten in the past as far as polio: if a person gets infected, 1 in 200 becomes paralyzed for life. It's not person's going to get better. And with it attacking infants and children, adolescents, it is a long life, but something has to be done. And that's where we as Rotarians have stepped up. And the VDP rate, though we only have a few cases left of polio, the vaccine-derived polio, where with the Sabin vaccine, it's using live, though weakened the virus, and it can mutate and become stronger. And we've had roughly 4.7 cases per million births. And with the new vaccine that's being developed and has received partial approval in some countries, that should eliminate that and get us even closer to totally eliminating polio.
Hey, Tom, it's Lindsay. There's 2 comments and questions in the chat before you go on to your next slide. One is from Jack. I don't know if this is a question or just a comment, but one problem I have heard is there are countries where donation COVID vaccinations are charged to the patients by their governments, so the patients being forced to pay for the vaccine. And then Mary Jo asked, how will India handle polio now because of obviously what's going on there with COVID-19?
Both good questions. To address Jack's first, I've heard that, I don't know, but I've also heard organizations stepping in to, once again, polio and COVID-19, you look at it and it's in the areas that are poverty level, undeveloped countries that don't have the education, the process to get this done, and other countries are going to have to go in to take care of it. So yes, I've heard that, and I think it's being dealt with. The sad thing is, even with COVID-19 and with polio, with anything, if there's a way somebody can make money off of it, there's going to be someone that's going to try and do that.
I just think it's a shame that when the government is doing it. For example, I know for sure it's done in the Philippines. In order to get COVID vaccinated, they charge their patients. Of course, they're not a very rich country.
Yeah, it's got to be public shame that eventually gets to them, but everybody's it's got to get taken care of.
Yeah, well, the shameful thing is I understand that polio was one of the first successful efforts on our part to eradicate polio with vaccine in the Philippines. And now the Philippines have a problem with COVID, and their patients, and the residents have to be charged in order to get a COVID vaccination.
Yeah, I don't know.
It's sad. I don't know either. That's why I brought it up.
And Mary Jo, India, it's, how do I want to put it? It's advancing, maybe not as fast as the rest of the world, but it is getting taken care of as far as the vaccine, COVID-19 vaccines. You still have a lot of doubters, not just in India, but in a lot of the countries. And, that's where we have a divided world. And I think COVID-19 is probably the best, not the best example, but a very good example of it, in the sense of, you know, you have to trust at some point. I know a lot of people that won't take the vaccine because they said it doesn't exist. And then it's like, well, there's proof here. So I don't know if that's addressing it, Mary Jo, but it's progressing across the world, and it will eventually get there, and it's going to be peer pressure from other governments.
Well, my concern is, you know, here's India, what, 2 years ago, that was declared polio free, and then now they've got this COVID issue, and there are cross pollination, if you will, of the diseases, and you know, it's frightening. Here we go again. We have to start all over with the polio eradication. I've always wanted to go on an IMD, so maybe there's my chance.
Yeah, but hopefully it'll be in a different country. But I don't know if I want to go to Afghanistan or Pakistan right now either.
No, it's me neither. But anyway, I'm sorry. Go ahead. But
No. This is a chart. I don't know how well you can see it, but it's something that we get on a weekly basis. And if you're interested, send me an email and I can get it to you. But currently we have 2 cases of polio, one in Afghanistan and one in Pakistan, as far as the wild virus type. It's progressing in the sense of we are getting close. There were, I think, 3 years where it started creeping up again. We had an outbreak and that got addressed. But right now, knock on wood, so far 2 cases of the wild polio virus that have been reported. And there's usually a week to 2 weeks, depending on the area, a lag time. But so far, it's good news, very good news. So how are we really doing? No cases this week. That's 11 weeks in a row. 115 days since the last case of wild polio virus type 1 in Afghanistan. 89 days since a wild polio case was reported in Pakistan. So 2 cases, that's it for since the first of the year. And last year at this time, we had 42 cases. So it's an improvement, but it's not done yet. So we still want to get there. Which leads me to the 2021-2022 District 5180 goal, and that's $250,000 just for Polio Plus. We've never been over 200,000, and when Desiree asked me to come out of retirement and be the Polio Plus chair again, she said, "What's your goal?" And she goes, "It'd be cool to do 200." And me being a numbers guy, it's like, well, what's wrong with $250,000? Let's do 250. And if we only get 200, I'm happy. I won't be, but because I think we can do it. And this is a whole list of things that we're going to be doing, but I will, in the slides coming up, I will go into each one to give you a little bit more information and give you time for some questions. Obviously, the first is club giving. If you're not aware of it, there's a Polio Plus report that you get from my Rotary and Rotary.org. It has what the clubs have given, how many members, what the per capita is, year-to-date numbers. Once again, I don't expect you to be able to read it, but just want to let you know it's available. If you don't know how to get it, let me know, and I will get you up and running so that you can see it. What we're trying to do, a couple clubs do it already, but we're trying to do it club-wide next Rotary Year. I've spoken to a lot of clubs. I've got a lot of coffee mugs. I've got a lot of pens. I've got a lot of bookmarkers. Books have been donated to a library or CASA. But if we're trying to create awareness for your speaker in recognition of what they've done, donate 5, 10 polio vaccinations. The price varies it's about 97 cents. It can get down to 50 cents. It can go up to $3 depending on where it needs to travel. And instead of saying we're donating $5 or $2 or $5 or $10, we're going to donate 5 polio vaccinations. We're going to donate, 10. Whatever is comfortable for your club, you guys send the money in. The speaker gets a certificate. I've got it in electronic form. I can send it to anybody. President signs it, put the club name in there. You want to frame it, go to the 99-cent store and buy a ton of frames for $1. It's just something, and if they hang it up, that's even better because it's keeping Rotary in front of everybody. So something that is easy to do, and hopefully it can spread throughout the district. And it's part of our way to get up to that $250,000.
So Tom, there's a question from Mary Jo in the chat. What is the time frame to determine that polio is eradicated? And then Joanne just said, please send the certificate. Great idea.
Okay. The time frame, the last one was hopefully no cases in 2023. But like my retirement plan, it's a 3 to 5 year moving target. We have to eradicate and have no cases for the year and then certify that 3 years later. So it's not going to be until probably 2028 where it's certified that the world is polio free. But we thought we were close 5 years ago and it strayed away. Hopefully with the new vaccine being used, that will take care of the vaccine-derived polio cases. The timetable, how much more money, every year, another year gets added on, but this is definitely one step closer in the sense of being able to eradicate polio. But then it's got to be a 3-year period where it's certified that no cases have occurred. And that's part of the problem with Afghanistan and Pakistan. You've got people that are moving constantly and that vaccination efforts have to be maintained. And that's one of the things people look at. It's like, well, how much more money do we really need? We only have 2 cases of polio. And it's like, yeah, but you have to vaccinate every newborn, and then some require 2 doses. So it's an ongoing effort. And I'd like to say in my lifetime, sorry, Mary Jo, I want to be more specific. The IRS says I have, I think, 22.7 years left to live. So in my lifetime. If you are not yet, we hope that you become a member of the Polio Plus Society. Many of you already are Paul Harris Society members where you've given $1,000, and many of you have become major donors. Last year, the Polio Plus Society was introduced. It requires 2 things, $100, but $100 every year until it's eradicated. So if it's 5 years, the expectation is each year you will continue to donate that $100. You will get a wristband, the orange, red End Polio Now wristband, and you also get the pin there on the right, the Polio Plus Society pin that you can wear. I think right now the district has 102. And we're slowly, from what I understand, are getting out the certificates and pin and wristbands. But we're going to try to get an additional 250 people this year. When I say this year, starting in July 1st. Once again, it's something that's easy to do, and especially if you want to keep a foundation minute in your meetings, nothing better than awarding one of your members the Polio Plus Society certificate and pin at the meeting.
Hey, Tom.
Yes.
What someone thinks that we might not be seeing the right slide. We're seeing the certificate. Which one is the right one?
Well, that was for the donation for the speaker. This is the Polio Plus Society.
Great. Okay, perfect. And then you do have a question and a comment from Paul. All of Tom's presentation is such an important message to get out to the world. The current vaccination phase desperately needs Rotary with nearly 40 years of successful experience with worldwide polio immunization. However, we don't hear anything in the news media about Rotary's role with the current COVID pandemic. Question.
Yeah, it's being worked on. I'm going to get in trouble with my love for the media here. In the end, there are so many other topics right now that are paramount for the newspapers to report on that they get readership and viewership. We, as Rotarians, I think every club has struggled trying to get some kind of a news item. If you have a local newspaper, great. But yeah, to me, that was one of the, I know Bill Gates has put in a ton of money, but having him on board and having his contacts trying to create awareness, all we can do is keep trying. And that's where every little bit helps, whether it's a wristband, wearing a Polio Plus Society pin or an End Polio Now pin. It's doing as much as we can and hopefully getting some recognition. I mean, Rotary International has a fantastic PR group and it's getting the word out. I know District Governor-elect Desiree is going to have a fantastic Polio Plus chair, but a PR chair. And that's what we're going to try to do. And one of the slides will be there, Jack, of, hey, if you have something that your club's doing, let us know as far as on the district level so that we can try to get the word out to everybody. That means more people coming to your events. And that's also meaning more people can learn about what we're doing.
And Joanne asked, do we sign up for the Polio Plus Society or is it based on annual donations?
This coming year, you actually have to sign up. And there is a form that we will be distributing to all the club presidents, foundation chairs, and Polio Plus chairs. Because on there, it says there is a commitment of $100 each year. And that's what we want. We don't want it to just stop after 1 year. Something we're starting here in District 5180. It's been around for 16, 17 years. It's called the White Hat Society. It was formed back in September at the Rotary Institute in Scottsdale. I wasn't invited, but zones 25 and 26, the governors there started this White Hat Society. For those of you who don't know, we're zone 27, but it's not limited to zone 25 and 26. There's currently about 400 members, and a little different than Polio Plus Society. You donate $5,000 in a given Rotary year, and you recruit one other Rotarian to do the same. It's a lot of money, but a lot of people are doing it, but we haven't. Russell Hampton is created a pin at no cost, and each time you donate $5,000, if it's 2 years later, 3 years later, you get an additional, concho that goes on the hat. But it's just another way of trying to recognize people, get the word out. And I think since 2004, they've raised over $6 million from its 400 members. Once again, it's something new to our district that we do not have a member yet. Our goal is to get 10 members. Desiree doesn't understand why I came up with this one, but we're going to see if we can pull it off. So we have the White Hat Society, which we're going to be introducing. October 18th, which is a Monday, we're going to have the Whole Lotta Love Charity Golf Tournament. It's going to be a district-wide event. It's going to be held at Yoche Dihi, which for those of you that don't know, it's Cache Creek Casino, and I have fun. It's in Brooks, California, 9 miles north of Madison, California, or basically 45 minutes north of Woodland. All the proceeds are going to go to Polio Plus. Anybody that donates is going to get Paul Harris Fellow credit. And we're resurrecting the Governor's Cup from the old Save Mart tournaments. We believe we've located it. That will be awarded. It's going to be open to everybody, but the Governor's Cup will go to the club, or the club foursome, I should say, that does the best. So we're hoping that every club will participate. It's going to be a lot of fun. And once again, just another way to try to raise money. At the district conference, which will be April 30th, and it will be in person, we're going to have a walk for polio. It will be the Saturday morning, and we're still working on the details, but everybody's going to get a wristband. They're going to get a Polio Plus End Polio Now shirt that you can see there. Once again, that will come as Desiree unveils more for her conference, but something that we can do as a district that everybody can participate. And once again, what I've always tried to push is if you make a donation and it's a district event, we want you as the individual to get the credit towards your Paul Harris or your Polio Plus Society. It's not going to go in as a joint from the district. It's going to be, this is on behalf of the individual that made the donation. Also up at the district conference, and past district governor Joanne Lemon will be comfortable with this, I hope. We're going to resurrect the duck race. Past district governor Joanne Lemon at the Trick or Treat at Squaw Creek had a duck race. I think we raised $10,000 that year. We're going to have one May 1st at the district conference. We're going to sell tickets for ducks. There's going to be $1,000 first place prize. And this is going to be going on. We don't want to step on the toes, so we're waiting for July 1st before we start selling the ducks, so we keep it in a Rotary Year. But club members, family members, if you have a business putting up a flyer, we'll have all of that, and we'll unveil all of that as we get closer. November 20th, if you like to ride a bike and like to ride it a long way, November 20th in Tucson, Arizona is the Polio Ride to End Polio, the Rotary's Ride to End Polio. It's part of the El Tour de Tucson that happens every year. That's District Governor-elect Desiree crossing the finish line with her hand raised. You can join the ride, bring your bike down there, or if you want, you can support her. She'll be going to clubs and trying to rally up support. Last year, $738,000 was raised for polio. That equates to $2.1 million when you look at the match that from the Bill and Melinda Gates Foundation. There is a team from Evanston that is there. The secretary is there. A lot of the department heads will show up and be part of that race. So if you're interested, Desiree will have more information for you. This is something we're hoping to take off the ground, is Rotaryopoly. Desiree has a superhero theme, so we're going to try to tie that in. but we're going to do a monopoly board, and we're hoping that each club will buy a street or avenue, and we're going to try to raise money. We're going to sell the game, but also we're going to try to get some advertisers that could also advertise. And we're working on having all the pieces. We're going to get a mallet. We're going to have a bell. But it's a great idea, but we want to get all 40 clubs involved. And we want, what we want to do is have the club name and the president's name in that square. And everything, I mean, we're going to talk about branding. We're going to do as much as we can to get the word out. And, you know, we'll make sure like a lot of our partners are involved in this so that we can raise money. The goal is to raise $20,000 when this is all said and done, but we need the help of all the clubs. We're going to have a foundation dinner in person. I don't know if the contract's been signed yet, but it's supposed to be October 30th of this year. There is going to be a special Polio Plus auction with 100% of all the money going to Polio Plus, and every donor or winner is going to get credit for the Rotary Foundation. We have one-of-a-kind items. We have the book, This Rotarian Age, written by Paul Harris, that is signed by Paul Harris. We have a 2020 Camus 40th anniversary 3-liter bottle, a wooden gavel from the boyhood home of Paul Harris, and a Napa 3-night stay. Just keep that in mind, and that's going to take place at the foundation dinner. Community partnerships. We are going to do a Rotary Cat at the River Cats game. It will not be virtual. We'll be in person. It will be it may be in this current season, but probably next season. As done in the past, you purchase a ticket. A portion of that ticket will go to polio in your name. And also we'll be sending, and clubs will be able to send children and children organizations to a game, and the River Cats will match that. So if you buy a ticket, we don't know what the prices are going to be, but let's say it's a $15 ticket and $5 goes to polio. If you donate that ticket, we can get a charitable organization to bring their kids to the game, and the River Cats will also send somebody and give us another ticket. And of course, the Bill and Melinda Gates Foundation is going to match.
Tom, we have a question from Joanne in the chat. Any idea of cost for Rotary-opoly squares/streets? Building budget now for next year?
Yes. It's going to range from $300 to $1,400. We're trying to tie it into the game without getting sued. It is going to be a licensed product, and I think Baltic and Mediterranean are 60 each. And we're thinking of maybe doing like 260 to tie in the last 2 digits. But Parkway and Park Place and Boardwalk, I believe, are like 14 and 1600. But that's what we're looking at, and we're going to have a binder, not a binder, but something that will go in a binder that will have a complete breakdown of all the sponsorship opportunities. Mark your calendars for October 24th, which is World Polio Day. We will be doing an event, but what I ask is, as I close, be a part of history. Not since smallpox is, that's the only thing that's ever been eradicated. Polio is going to happen. Do a pizza for polio. Do a concert, a walk, but register your event with RI and the district. And if you're not familiar with Raise for Rotary, go to the rotary.org and type that in. You can set up your own GoFund Rotary through Rotary, and it's a fantastic way of doing it. But we're going to have more information, but we'd like to get information from all the clubs so we can pass that information to all the other clubs. Why do we do it? As I said, smallpox, it was eradicated in 1980 after killing over 300 million people. The US spent 300 million then. It saves $1 billion a year ever since then. According to WHO, we've been able to prevent more than 13 million cases of polio since the year 2000. And if we don't do it, within 10 years, polio could get back to the US and could be affecting over $250,000 a year, or 250,000 children a year. And my number one reason, it's been polio's been Rotary's number one priority. It needs to be ours as an individual Rotarian and also as a club. So we have a lot of things to do. Just let me know. If you don't have a club polio chair, please get one. Pass your Polio Plus goal that your club has. If you need a speaker, we have speakers that can do it for polio. Support our events. We will support yours. There's 2 websites you can go to, and I want to give you my contact information and a quote from Jonas Salt. There's no such thing as failure. There's just giving up too soon, and we can't give up too soon. We have to finish this. So thank you, everybody. I think I went over a couple of minutes. If you have questions, get them to me. More than happy to get you what you need and what you any questions. If I can't answer it, I'll get you an answer.
Thank you so much, Tom. And I did respond to some folks or somebody in the chat and gave them your email privately. So I'm glad that you put it up publicly. So yeah, I think some people are probably interested in having your slides. So you can use that email to contact Tom, and I will throw it in the chat again if you didn't get a chance to write it down. We do have or no, that's not a hand raise. That's just some applause. People are using the Zoom reactions and giving you applause. It was a wonderful presentation. As a newer Rotarian, I learned a lot about Rotary's efforts and agree that Rotary International should have been consulted for the rollout of the COVID-19 vaccine, because it seems like we have a history of doing it right. So with that, this is the last session of the Festival of Learning. I'm going to turn it, yes, a huge applause. Thank you to Rob, to Mary Jo, to Desiree, to Karen. I'm going to turn it back over to the masterminds behind this whole 4-week project. I can see them pointing at each other, but because of Zoom, they're pointing in the wrong direction. So I'm not quite sure. So I will unspotlight myself and Tom and turn it over to whoever wants to jump in if you want to say anything, since this is it. This is the end.
Well, thank you very much, Lindsay, and thank you to everyone who attended the session this morning. It's been evenings for the last little while, so I think we need to give up the channel, however, because we've got another meeting coming in. But again, thank you all so much for joining us this morning, and then also supporting the Festival of Learning throughout the month. It was a lot of work and also a lot of fun and very rewarding to be a part of. So, and also thank you to Mary Jo, who has been instrumental in helping get this whole thing together. They're calling me the chair. The reality is that I'm really a co-chair with 3 other people who've been doing a phenomenal job. So anyway, thank you very much. And Mary Jo, coming up, will have other training programs that will probably piggyback a lot on the Festival of Learning through the next year or two. So it'll be a really great time for our district. Really great time for our district. So
thanks,
again,
Rob. And Rob did all of the details. So he is to be commended for all the parts that he has done. Desiree and her leadership, and Karen, we wish her well as she continues her healing process, and Desiree's at the Pinewood Derby. So, everybody else is, I don't know, here we are, Rob, just finishing it off. So Thank you everybody for all your participation. It has been a great month. I wanted to say a couple days, but no, month. So thank you.
Thank you both.
Thank you both. An amazing experience. Yes, thank you.
gotta leave so that the peace
Yeah.
committee can have their meeting, because it's
Okay.
on the same channel.
Well, have a good rest of your weekend. Thank you so much.
Thank you.
And thanks,
Yeah.
Joanne, for all the help.
You're welcome.